I'm going to talk about our radiation monitoring devices, or dosimeter. We wear these whenever we're taking radiographs for safety purposes. It works to measure the gamma particles, the beta rays, the X-rays, ionized radiation that hits this when exposed to any radiation. We obtain the readings by sending our devices off. Here at Roanoke Animal Hospital, we send it off to Radiation Detection Company, and they send us back quarterly our reports. It should be worn whenever you're exposed to radiation. Whenever we're taking radiographs in the hospital, make sure every member that is in the radiology room has their dosimeter clipped to them outside of their lead apron, of course. It should be worn when taking x-rays right on the collar outside the lead apron. Some of us, when we put the thyroid shield on, we'll clip it to the thyroid shield. There again, make sure that the badge is hanging outside of the lead apron. If it is worn inside the lead apron, that is not going to be an accurate reading. The MPD, or maximum permissible dose, for veterinary staff annually is 5 REMS, or REMS, or 5,000 millirems, as it is described on our quarterly reports. So here's our report. We do it quarterly here. I'm going to look at in here. For the current dose, it shows the millirems. She got 36 I 40,000 43 milligrams. For the year, she also got the same amount, 43. So she was indeed under the MPD for the year, as that was only 43 milligrams, and the maximum dose is 5,000 milligrams. I'm going to demonstrate how we put on our personal protection equipment, or PPE, here at the hospital. We have them hanging up here in the radiology. First off, I always start by putting on my lead apron, drape it over. There's a little tab in the back to help keep it up over the shoulders, as well as a tie strap around the waist to keep it secure on your body during, while taking radiographs. We also have thyroid shield that we take. It's just a simple Velcro that we put around to completely cover the thyroid area. Then, of course, the dosimeter that I will clip to the thyroid shield and make sure it's hanging outside the lead apron so it is visible to monitor my exposure. We also have our gloves that just simply slide on, easy off and on. That way, for during positioning, we're able to quickly adjust the animals as needed for the radiographs. We don't have the lead glasses here, but those also can be important to use to help protect your eyes from potential radiation exposure. You also want to give it a good visual inspection before every use, just to make sure, if there's any obvious cracks in the lead, that's going to be a leak where the radiation can get through to you, therefore defeating the purpose of wearing the personal protection equipment. So I'm going to discuss some general radiation safety. There are 3 methods of restraint used in radiology: manual restraint, non-manual restraint, and sedation. Manual restraint is where the technician and an assistant are physically holding onto the animal, positioning them, and keeping them in the proper position for the radiograph to be taken. Non-manual is where they would position the animal and then use aids such as a trough or sandbags to keep the animal in that position, allowing them to step back, increasing the distance and taking the radiograph. Sedation is where the animal is completely sedated, can position the animal and even step out of the room, take the shot, and greatly reduce the amount of exposure that they are exposed to. There's 3 different positioning aids that can be used when using the non-manual restraint or even manual restraint. They can be something like we also sometimes utilize V troughs. We'll place the animal, we especially use them when we're taking VD exposures, We can place the animal on their back, help keep them comfortable, keep their body straight and in a good position, a good alignment for the radiograph. We will also use gauze ties if we're taking exposure of the carcass. We can loop the gauze around and pull it out, get it straight, as well as keeping our hand farther from the primary beam. We can also use things such as sandbags or tape to help keep, like a tail down, straight, and even, and out of the rest of the shot we're taking if we're having to take, a VD pelvis, for example. There are some physical protective barriers that can be utilized as well, other than the personal protection equipment. There's something that's like a lead shield that you can have. It's basically the same thing as a lead apron, just on a frame that you can have up, that you can put between yourself and the primary beam. That way when the scatter radiation happens, it has more things to bounce off of before it reaches you, therefore reducing your exposure level. Distance and exposure time can also be utilized as safety measures. When the distance is doubled, the exposure is lessened by a quarter of the amount. So being able to stay a foot away versus 3 inches away greatly decreases the amount of exposure that you get, which overall, over the lifetime, over annual, will keep you well below the maximum permissible dosage. Exposure time can also come into play too. The longer that the cathode stud is open, the more radiation is sent out. So therefore, if it's just 1 second versus 2 seconds, the shorter the exposure time can be, the less exposure. No portion of any human, shielded or unshielded, should be exposed to the primary beam. Nothing that is the highest concentration of radiation, so you want to keep your hands, limbs, any part of your body out of that primary beam. Non-essential personnel shouldn't be in the x-ray suite when we're taking the radiographs. It should just be the technician and the assistant to help with positioning only in here. If you don't need a third person, why expose that third person? They should be removed from the x-ray suite while taking radiographs. Taking radiographs, you want to get diagnostic imaging on the first exposure. This, there again, reduces the amount of radiation you are exposed to. If you have to take two exposures of the same image, that's twice the radiation you are exposed to. So the quicker you're able to get it, the more efficient you are at getting it on the first shot, the better it is for everybody involved, both the technician, assistant, and the animal. When you're exposed to radiation, the cellularized water is ionized, and therefore this can cause genetic defects. And so for pregnant women and those who are people under the age of 18, their bodies are just developing, they're at higher risk of complications from radiation exposure. This can cause genetic problems, cellular problems, and so you want to keep them you do not want to expose those who are pregnant or people under the age of 18 to radiation. So I'm going to take a radiograph of the craniocaudal radius ulna. We're going to go into bingo here. Let's add it. We're going on to his left front leg. So here in our system, we only have it labeled as radius. And here's our craniocaudal. So I'll click and add that. I will add the doctor who ordered it, which is Dr. Hart, and the technician, which is myself, Heather. So now let me set you up over here so we can see as I explain the process. So for him, since it's on a forelimb, we're doing KVP setting of 80 and MAS of 2.5. Get all my personal protection equipment on. Including my badge. Alright, buddy. I'm going to kind of get the collimated. I need to make sure, getting the craniocaudal of the radius ulna, that I get proximal to the elbow and distal to the carpus to make sure we have the joints both above and below the bone that we are looking at. Alright, buddy, you ready?
Come on, then.
Come on.
Go.
1, 2, 3. We're going to position him in sternal recumbency with just the affected limb in the primary beam. Oops, lay down, bud. And his leg's a little ouchy, so trying to be a little bit gentle on that left leg there. Come on, buddy. You gotta sit up. Now that we have distraction aid in place, we're gonna get him to lay down in sternal recumbency. Lay down. All the way. Lay down. Alright. Will you get your gloves on? For this, I'm also going to use tie gauze as a restraint positioning aid to help keep his leg straight and even. As I have my gloves on, Chris is going to help me hold his head up and out of the picture. Drops going. All right, now we're going to let him relax. So now once the picture is taken, here is the shot of the craniocaudal radius ulna. You can see that the elbow is in there as well as the carpus, so we have both the joint distal and proximal. So I'm taking a VD thorax on Boo Boo here. So I'm going to pull it up in our digital system here. Then on Boo Boo, adding it, going to body, thorax, and VD. Put it, request assist the image study, so I'll have Dr. Blazak, who requested it, myself, as a technician who's taken it. So put you over here so you can see as I walk us through how we take a VD thorax. For Boo Boo here, we're a cat, we're small, so we're going to have our KVP down to 80, so we get the proper view and density. I have our right marker. And for positioning, take a collar off here real quick too. For positioning, we're going to have the cat in dorsal recumbency. We're going to have the hind limbs pulled back as caudally as possible, and the front limbs pulled as cranially as possible. I want to have the columnation, the thoracic inlet, down past the cycloid process, and laterally, of course, to the body walls on each side. Turn this way. So there I have the cranial columnation up to the thoracic inlet. Actually, I'm just going to the whole body down on the tray a little bit. There we go. And you can feel it's kind of to the last rib is where the caudal columnation is at. So let me slide my gloves on here real quick. Now that we have her positioned, we'll wait till peak inspiration. Take the exposure. Now I'll let her relax a little bit while we double check our image. And here is the image. You can see I have the marker in place. We have up, we have down, and so that would be the proper image needed for the VD thorax. So I'm taking a radiograph for the VD pelvis, OFA quality. Here I'm going to pull it up, the radiograph image study in our computer here. Click on NARA, hit play, and then it comes up with showing the body, the VD pelvis, with the doctor that ordered it, as well as the technician, which in this case is myself doing it this time. I'm going to turn on our machine and our settings here. I have to turn it on first off. And for her, she's going to be set to 90 kVp. MAS automatically adjusts to 2.5 here. You can see 90 for the kVp. And I'm going to go ahead and kind of collimate here. We're going to kind of use a couple positioning aids to include a trough for her upper body to keep her straight, as well as we'll use some tape to keep her tail straight and aligned with the rest of her body as well. Let me set this over here now. That way you can still see what we're doing here. Get my personal protection equipment on. Now that we have all of our personal protection equipment on except for our gloves, which we will put on once we are in position, we will go ahead and get the dog positioned. So we're going into dorsal recumbency. Going to kind of collimate properly here. The label is at the cranial aspect of the pelvis. You know, I'm just going to kind of position before actually taking the shot to ensure that I have good culmination. I need to go to the top of the ischium. I'm going to scoot a little bit down. I want to make sure that I'm also distal to the patellas because we want to make sure that the knees are in there. I'm going to open it up just a little bit more, as well as scoot a little bit more down. You're going to make sure the labeling is at the cranial aspect. Okay, so now I'm going to take some tape. I'm going to take her tail down to make sure it stays in line with her spine for proper viewing. Double check my thing. My collimation to the borders goes just to the edge of the greater trochanters. So I'm actually going to make it a little bit more narrow. Now that I have proper collimation, a little bit more in, a little bit more towards you again, Whitney. So now, with full personal protection equipment on, you want to keep the legs straight and parallel with each other, and you want to make sure that the patellas are lined up over the trochlear groove. There is the exposure. And now we will view it. Let me get my camera off here. And so here is our image. You can see we have all the way to the top of the ischium here. This is the patellas. The patellas are over the groove. And so that is the OFA quality of the VD pelvis. I'm going to show how and walk you through how we retrieve image studies after we have taken radiographs on our computer software here. So looking at here, this is the list of patients that we've taken radiographs on today. You can see the date is from and to. Today is March 27th. So I'm going to hit today and that will search and bring those up. We're going to look at Bo Bueller. So I'm going to click on his name. And you click on the view button here. It will kind of take a few seconds to retrieve them and queue them up, and you can see them, they are loading on the software here. So once that is done, I will click that out. For some reason that one's saying it's unable to display image. I'm able to click up, you can see the whole entire study up at the top. I'm able to grab one down and pull it to view it, so we can see the lateral right pelvis view that was taken earlier, as well as a VD of the spine. You're able to kind of pull them all through and see them and view them side by side for comparison shots. And that there is how we pull up our image studies once we have taken the radiographs. So I'm going to talk about the barium study, contrast study of the upper gastrointestinal tract. For this is a useful way to check the morphology of the small intestines and the stomach, and as well as the emptying times of the intestines. For this, we use barium sulfate suspension. The process behind this, is useful if a patient is presenting with recurring vomiting, anorexia, or suspected foreign body or obstruction. This is a good way to check the emptying times and motility of the upper gastrointestinal tract. The process behind this is we would take an initial set of x-rays, a lateral and a VD of the abdomen. You want to include from T7 through the acetabulums, that way you can see the whole entire tract. So once you take that initial set of x-rays before you would then give the barium sulfate, as soon as you give the barium, you take an initial immediate another set of x-rays, and that is the 0-time film. At that point you would generally be able to see the barium in the stomach. After the 0 time, you then take another set of lateral and VD radiographs at the 15-minute mark. You then take it again at the 30-minute mark, then the 60-minute mark. From there, you take it every hour until you see the barium reach the distal end of the small intestine. And that way you can check the times of the emptying tract. And there again, just to make sure that there's nothing wrong with the upper gastrointestinal tract. So here, I'm about to walk us through doing this on one of the kitty cats. So we're doing using barium sulfate suspension to do a contrast study on our cat here named Simba. For the study, we're going to give about 28 mils of the barium to check the motility, as well as check for obstruction of the upper gastrointestinal tract. For this, first off, of course, we're going to start giving barium slowly. A lot of times you can just kind of put it right in their cheek, and you want to slowly give it. We have them wrapped, that way, as you can see, it does tend to make a little bit of a mess. You don't want it getting on the patient, because then, since it is radio opaque, you will see it show up on the radiograph. Easy, buddy. I know. Good boy. I'm just giving it a couple mils at a time, actually less than a couple mils at a time, really. That way, he doesn't choke on it as it's going down. Yeah. No fun is it? Sorry, Jess.
I'm not worried about it. Not having any hand rads taken anytime soon.
I'm just gently lifting the corner of his cheek to put it right there in the corner. Let me see.
He's being really good. He is.
Alright, so now we're going to take our 0-time film of the lateral and VD. so you can see here, this is our 0 time. You can see the barium there is in the stomach on both the lateral and the abdomen, the VD. So we'll come back in 15 minutes to take our second shots in the series. Alright, so now we're taking the 15-minute mark film on Simba for a lateral abdominal and a VD. So now we'll compare our images here. So we had our 0 time film of the lateral, and now here's our 15-minute mark. You can see the barium start to make its way through the intestines. As I explained earlier, you want to, we would take another x-ray at the 30-minute mark, the 60-minute mark, then every hour until we reach the distal end of the small intestines.
Hello, my name is Jessica Hester. I'm an LVT. I am Heather Story's mentor and preceptor through her adventure through technician school. Over the course of the time that she has been taking this radiography class, her skills and knowledge have improved greatly. She receives very little instruction from me anymore about some of the more complicated positioning and shots than sometimes, but for the most part she has a great handle on how to do everything. She definitely is fantastic at picking out how to position the patient, even down to fine detail as far as taking chest rads at peak inspiration and abdominal at peak expiration. Obviously, her technique is always spot on. She always produces very clear images, very rarely has to retake anything for doctor's happiness. Her only weakness that I can possibly think of to mention is collimation. A little bit tighter collimation is always better. Not to say that she takes wide open views or anything like that. She still does collimate pretty appropriately, but that's about the only thing that she can improve upon, in my opinion. She's taking very good quality x-rays, just like she's going to be a good quality technician. So I'm very proud to be her preceptor and to speak on her behalf.